So Philips is not a startup. It's a pretty big company, 108,000 people, sales last year about 21 billion euros, and you probably know it for the lighting, for the consumer products, but it also has a rather big healthcare element. In fact, it's the biggest part of Philips, I think. And Peter, who is CEO of Philips in GmbH, the man who is responsible for kind of growing the healthcare aspect and seeing where a new approach to continuous health monitoring, to seeing the patient as, well, seeing the consumer as empowered rather than a patient. Tell us, first of all, Peter, what Philips sees as the big opportunity in healthcare enabled by the new technologies.
Yeah, first, good morning, everybody. Very happy to be here. And David, I have to compliment you. You did very well your homework. So all the data is 100% correct. What are the challenges in the healthcare and what are we doing as Philips? So if you look to Philips, we are in quite a transformation where we are bringing the consumer part and the healthcare part together. And that is exactly what the future and the challenges, but also the opportunities will bring for Philips, but also for the whole healthcare systems. Because if we look to first the challenges, David, I think we do have a lot of issues, let's say, globally on healthcare issues. One thing is, of course, that people will become older and older, and hence a bigger demand for healthcare, but also higher cost. On the other hand, you see also that, especially in the Western European countries, the demography is not so positive, meaning that there are less people. So if you combine these two with the large amount of chronic diseases, people with chronic diseases, then of course there's quite a challenge. There's a challenge of our healthcare systems, also a challenge on our healthcare budget. On the other hand, and that's maybe more the exciting part, we are not patients alone. So in previous times when we talk about healthcare systems, we're talking always about patients. But the patients are moving into consumers. Actually, we are all consumers of the healthcare system. And that makes it so interesting, because what does it mean is instead of more focusing on treatment, diagnostic, it will be much more on healthy living, prevention, actually the whole healthcare continuum. And that, I think, is the future. So we have challenges, but we have also a lot of opportunities here.
But you're a product company. You make things that we as consumers buy and use. What specific products do you see Philips producing to enable this new healthcare economy?
Yeah, I think most of us know Philips from the products. You're also a consumer, so you know Philips very much from the products. However, we are very much moving from products to solutions, to integrated solutions. So also, if you look to let's say, the healthcare products, and especially if you look to the prevention part, it's not anymore about the products alone. It's the hardware, it's the software, but it's also, let's say, the services around. So as we were introduced about the Blue Touch, it's, I think, a very nice example, David, where, let's say, for people with back pain, and there are many people, of course, who have this problem, there we have the Blue Touch, that's the product.
So the Blue Touch is a clinically validated device that has bright blue LED lights that you put close to your skin if you have back pain.
Yeah, so it gives warmth, but also with the molecules, it will also help to treat your back pain. But it's not only the hardware. It is also then the software, so you can download, let's say, the progress you made. And we have a very good cooperation, partnership with Allianz Worldwide Partners, where we do also the whole personal coaching. So it's not only that you say you have the product and the software, no, it goes along with professional coaching to help to improve your back pain. Unfortunately, I don't have it myself, and maybe I should have, because this morning I had a little back pain. But my head of communication has problems with his back pain. He went to such a coaching session with Allianz, and he told me yesterday it was really, really remarkable. So it's really going from product to total solutions, and I think that's the future also for the whole healthcare.
Do you see any resistance with the patient sharing their personal data with the health insurer?
I don't think so. It depends on how the whole privacy is being protected. We are working in Philips on a total integrated IT platform. We call it internally the Health Suite digital platform. In Philips, we're also good in abbreviation, so it's now called HSDP. So if you see HSDP, then you know it's the Health Suite digital platform, which integrate the total personal information, and it's cloud-based, as well as also the information, the clinical information from hospitals. It's possible. You can it 2 times encrypted, 3 times encrypted, so it is also protected. And I do see a lot of potential here. I think privacy law, let's say, of course, it's very important that your personal data, and especially in terms of healthcare, that it's well protected. But in the current IT world, it is possible. Okay. What I personally see, especially in Germany, because I live now for 3 months in Germany, that there's a lot of discussion about this privacy law and how to protect privacy data. It's called in German Datenschutz. But it's so much focused on where actually we are not moving as a sector into the right direction. I was last week in a congress, and there was one professor, and he said Datenschutz kills people. That's maybe a bit of a bold statement. But it shows, let's say, that when we do have the possibilities to protect private information and the opportunities we have in a total integrated IT system, the whole digital era, it's enormous, David.
So by sharing our data with the network, we can empower ourselves, we can track upcoming health problems.
Correct.
So apart from solving lower back pain, what sort of monitoring devices does Philips see as worth putting to market? What are you working on now, and what are you thinking about working on in the foreseeable future?
Maybe I can mention 2. If we look to, let's say, and I think are interesting examples. If we look to 2 major diseases or potential diseases we are facing in the world, is one cardiovascular, heart problems, and the second one is oncology, cancer. Now, if you look to cardiovascular problems, and then, as I already said, we have taken the consumer and the medical together, so we call it the Health Continuum. Mm-hmm. It starts already with healthy living. Let's say a lot of cardiovascular problems is actually, the origin is high cholesterol, high blood pressure, overweight, these kind of things. We can already do a lot in this stadium. Then the second part is the whole monitoring. We do have solutions which can monitor you at home on how you're doing with your health. So 24 hours measurement, if you want, with a chip on blood pressure. We can measure your heart monitoring. We can measure your weight. You can measure, let's say, how much do you walk, let's say, to improve, let's say, your whole stamina. So a lot of things we can already measure that can go into, let's say, via the digital capabilities into this IT network, where also the doctors can see how you are progressing.
So before going into the other oncology products, how is this going to work? Is there a Philips device that will wear affixed to our skin near our heart? What sort of form factor do you see this taking?
It is all a bit about the future, but we do have already devices that monitor your heart at home which, let's say, can be then, all the data can be registered on via the digital capabilities and possibilities, so that also the doctors can see how you are progressing or how
so you'll wear this 24 hours?
Yeah, it's possible. It's possible, David. The second thing is scale, of course, blood pressure, pulse, everything we can do. We did an interesting study in the Netherlands for 2 years, where we did this with, I believe, around 200-300 patients, but really chronic cardiovascular patients. We did it where we then did 24 hours monitoring, and the results were amazing, really amazing. So in these 2 years, that they get a reoccurrence of the diseases was being reduced by more than 50%. If they have to go, let's say the readmissions to hospitals reduced by 50%. I even read with our internal study that only for the Netherlands, and I am Dutch, so of course we feel that's a big country, but let's say in the global it's 40 million people. It would only for, if we would introduce this in whole Netherlands, it will also, apart from, let's say, the positive part on the health, it will also reduce the cost by around 80 to 100 million. So the good part with these solutions are twofold. First is that the patients feel better, is home, feel safe. And the second one is, of course, that we reduce the total cost, the total healthcare cost. And that makes me so exciting, while I see a lot of opportunities here.
But a lot of companies are producing wearable devices that say they track your heartbeat. Apple's produced a watch that does that.
Yeah.
There are phone covers that take your heartbeat. You're competing in a very busy world. What's going to make Philips devices stand out?
Yeah, that is true, and that also shows, David, how hot the topic is, and that is also shows when I started to say the patients moved into a consumer. We are consumer of the healthcare system. What makes us different is that we have, as a company, the consumer knowledge and the consumer insights. But as you also started in your introduction, let's not forget that our biggest domain is healthcare. A lot of people, I think, also in the audience think, okay, Philips is from the consumer products, and I would also absolutely recommend our consumer products. But actually, the biggest sector is healthcare. Now, the combination of these two, where you have the consumer insights, but on the other hand, all the medical knowledge and the clinical knowledge, that makes us strong. Because, as I mentioned, it is not about a device and a software, it's about the total integrated solutions. And that means that also the healthcare knowledge will be extremely important. Because yeah, you need to have this clinical background, you need to have all the devices needs to be clinical tested, and also also the relationship with the hospitals, the doctors, yeah, that's very important.
So the question of trust comes in. So yeah, we've got absolutely devices that help prepare your back, yeah, using hardware and the network that's collecting the information. We've got devices that track your bodily metrics, your blood pressure, your heart. You also mentioned some of the work you're doing in oncology. Oncology,
yeah. Oncology is, of course, a disease which we all don't want to be familiar with. So it's also not that we say, okay, let's buy a device for oncology, because that's nothing that you want to prevent. But what we do have is, and that it's called mini care home. It's actually a kind of mini laboratorium, but that you have at home. I will explain a little. So when you have a cancer and you will get the chemotherapy, a lot of people actually don't know that also chemotherapy can be very much personalized. When you put chemo in, actually it kills the cells, but kills also the good cells like your white blood cells. How it works in chemotherapy is that they put in doses, and then they will look how fast you will recover. Because if you put too much, you will not recover. It's very damaging. The way you recover depends from person to person. So though we all, not all, but I think quite some people think that all chemotherapy is all the same, it's not. It's very personalized. So it depends on how fast you can recover, and that defines you can solve the cycle time, so how fast can you have the next treatment, and how much can be the doses. Now, with this mini-care home, what it does is you can take yourself the blood. You don't need to go to the hospital. You put the blood in, let's say, this machine, laboratorium quality. It will tell exactly what is the status of your blood cells, how far are you recovered from your chemotherapy. That will automatically go to the oncologist in the hospital, and he or she can then decide, okay, the patient needs to stay a little bit longer, or cannot have new therapy, or it cannot have therapy. Now, what happens is that you constantly need to go back to the hospital, need to check, it's not needed anymore. So we do a pilot in this respect in the UK. That's always nice to work in a global company, because the cardiology we do in pilot in Holland, the Blue Touch in Germany. This one we do in the UK. And the first results are very, very positive. Positive because of, let's say, that the patients have much better treatment and recover much faster from the chemotherapy. But also, let's say, fantastic because the patient don't have to go constantly to the hospital, but can do things home, and with the digital options and solutions, can have an interactive discussion with the oncologist.
But all of this means we're going to need fewer doctors, fewer nurses, because we will be taking much more care of ourselves and using data tracking devices to take many of the tests that doctors have traditionally taken. I think Vinod Khosla talks about 80% of the tasks a doctor now does will be done by machine. Are you getting much resistance from the medical establishment?
It depends, David. Let's say, yes, some of, let's say, more the traditional ones, they say, okay, is this the right future for healthcare? However, and I started already, we don't have any choice, to be frank. Each person can look globally, not only for Germany, but globally, to, let's say, to what kind of challenges we face. And we just face that the people are getting older. There will be more older people, less, let's say, in Western world, people who can support. So chronic diseases will only increase. I think also when the doctors, and we have very positive discussions there, they understand that there's no choice. Also, one thing also with, as an example, with the University of Aachen, with Professor Marx, we have two big projects in telemedicine. So also, let's say, the doctors see the need for it, and we do then telemedicine in two ways. First is a more intensive care for more the country hospitals towards the university clinic, so that the university clinic can do intensive care service, but then on remote basis. And the second one, telemedicine, is that you can earlier go home, but you are still being monitored by the professor, by the doctors. So I have to say a lot of doctors understand this, see the possibilities, see the opportunities. I'm from a doctor's family, and what I know is that doctors are very social people, and their main task is to make people better and have the people feel better. So I think we are all in the same boat.
So we hear from a lot of startups that are 2 or 3 person organizations, and they found a chip that's a microarray that can detect your blood, or a new sensor that can track your output in terms of sweat or stress. You have an R&D department with, what, 8,000 people?
Yeah, around 8 to 10,000 people.
So you are the guys who really can make a difference on a global scale. What sort of specific technologies do your R&D team see as coming to the consumer maybe in 5 years to 10 years? What will the wearable of the future be able to do that your teams are starting to think about?
No, I would say that, and that our R&D team is busy with, is that indeed that you have one chip, let's say, under your watch, which can measure actually almost everything, which will be immediately all the data will be sent to the doctor if you want, or at least to yourself, that you will have a warning. And that will measure your blood pressure, your heart. We are also working very, very much for cholesterol, which is of course also very important. And will monitor you 24 hours just to prevent that you are getting sick. I think that is one of the developments. But David, let's not forget the major development will also be in the software and in the total solutions. That is also innovation. And at this point of time, if you look to the whole digital world, and especially software in health systems, it's very fragmented. It's unbelievable fragmented. What means that even if you measure a lot at home, at the moment you come to a hospital, actually the whole diagnostic starts from scratch. And that's not needed. That's absolutely not needed.
So last question from me. Do you see the wearable as we've already seen it? Is it going to be a wristband? Is it going to be a patch on the skin? In 10 years, how will our bodies be physically connecting that data to the network?
No, I think it can be one chip under your watch, because a lot of these wearables, let's say in terms of design, can always be better, though we are also working now with our design department to make it nicer. Where just with one single chip under your watch, you can measure everything. So there's a lot of opportunities here. But also to give, we have a big R&D center also in Klagenfurt in Austria. I was there a month ago. Yeah, they are busy in, okay, with when you have a certain disease, what kind of food do you need and how do you need to eat? And you can have just an interactive program on what kind of, what your diet should be if you have a certain, you personally have this or that the disease of chronic disease. Also that will be the future, and that will be all instant via apps or via digital. There's
so
another
the future of healthcare won't be doctors, it will be a tiny little chip that will track everything about you and let the network tell you when you need to change your diet and when you need to
let's say, if you look, let's say, to the whole health continuum, if you look to healthy living, prevention, and then actually starting with diagnostic therapy, treatment, and aftercare. If you look to the last part, which most of us are familiar with as patients, which costs for instance, in Germany, let's say this whole health costs 300 billion. Actually, the first part will determine more than 50% of your whole health than actually the last part.
So we'll live longer, more healthily, and save the state money. And if you want to discuss these issues with us and with Allianz as well, there's a workshop at 12:30, I think. Thank you very much for listening. Thank you, Peter Vullinghs of Philips.
Thank you. Pleasure.